How to write mental assessment. Background information will help you to establish context for your assessment. Put the patient at ease so that the interview will be fruitful and informative. Check all the boxes on the assessment that apply. Annotate wherever additional description is required. Encourage the patient to provide a narrative using their own words. The story they provide enables them to describe associated social circumstances and emotional reactions that might not, otherwise, be revealed. Record cultural factors on the assessment paper. For this portion of the assessment you should include ethnicity, immigration, language, religion, sexual orientation. Complete a narrative summary of your findings. Describe the patient's presenting mental health problem. Include current symptoms and behavior. Include birth, childhood, family history and social relationships. Describe the patient's family history and current relationships. Assess risk factors for the patient. Complete the mental status exam checking all boxes that apply. The Diagnostic and Statistical Manual of Mental Disorders is used to categorize psychiatric diagnoses. However, the format is changing. The new format begins with the principal diagnosis, and this condition should be followed by the phrase principal diagnosis or reason for visit. Recommend treatment for the patient. Your recommendations should be based on your narrative summary and assessment. Your assessment should conclude with a statement about the patient's understanding of the course of treatment and its goals. This portion of the assessment shows that the patient is aware of the decided course of treatment and is willing to work with it.
Indicate previous assessments, dates of diagnoses, referrals and responses to treatments. Make note of the impact of cultural factors on the patient's behavior. An expansive written interpretation of the information is collected and how all of the elements recorded contribute to the patient's presenting problem. Include a description of the onset of the presenting problem, its duration and intensity. Indicate the patient's medical history and current status. For example, Jim is HIV positive and has been for 3 years, with a T-cell count within the normal range. Address a wide-ranging list contributing factors from the patient's support system to education and employment. Provide detailed information that offers an assessment of the risk factors as determined by information gathered during the interview. This will include thought content, obsessive, hallucinations, delusions, affect, mood and orientation. Your comments and descriptions will be required. Insurance companies may still require the old method, which assesses 5 dimensions, axis. Include a diagnosis for each axis. Your treatment goals must be measurable with specific time frames for completion. Compile a list of treatment goals. Examples: reducing risk factors, decreasing functional impairment. Indicate planned preventions with patient participation. Examples would be anger management, parent training, problem solving. Patients report a better outcome to their treatment when they're in agreement with their practitioners about the course of treatment.
If you liked the video, subscribe to our channel for more awesome videos. Check the description below and thank you so much for watching.